For the first time in a month, a Dothan man is finally home with his wife and kids after an injury sidelined him for a month. Our Aaron Dixon once again with the story.
Tom Haney competed in a volleyball tournament for Encompass Health in May, and not even a month later he was admitted to the hospital, and then the journey to recovery began. Haney wasn't feeling well in June, and so he went to the emergency room with his wife.
So we started this journey about a month ago. Tom wasn't feeling well, so since he wasn't feeling well, went to the emergency room, and that's when they discovered that he had this aneurysm.
When they arrived, they learned that Haney had suffered an aneurysm in his leg. So then he went to a hospital in Pensacola to have the surgery done. Haney worked with physical therapists for a month at Encompass Health, where it started slow. But then Haney began to set goals for himself to do things independently.
He was one of those that he was always up, ready to go early in the morning, very, very gung-ho about getting independent so he could get home because he knows what he has at home.
On Friday, Haney finally got that chance to go home to hang out with his family for the first time in a month.
The time frame, it's been a month since all this has transpired, so I haven't been home in a month.
During the first half of his recovery, Casey says they weren't sure what changes they were possibly going to have to make. And now she says he's going back better than when they started in the emergency room a month ago.
It's a job well done. The thing of that is also seeing that patient's face when they realize what they have had to overcome to get to where they are now.
Haney is now home and with his family, which his wife says the kids couldn't wait to see their dad.
They're excited. Like it's, we're both excited, but I think they're more excited than we are.
The Haneys want to thank their physical therapist for getting Tom back on his feet and independent after only a month of recovery. In Dothan, Aaron Dixon, WDHN News for the Wiregrass.
And now onto the coronavirus front. The entire state of Alabama continues to see a high rate of COVID-19 infection. As of today, the state's COVID-19 positivity rate is 29%. Every single county in the Wiregrass is considered high risk for COVID-19, meaning the county has the positivity rate higher than 10%. Both Coffee and Geneva counties have the highest rate of transmission in the Wiregrass at 39%, with Henry County having a positivity rate of 38%. Houston County a transmission rate of 34%, and currently Dale County has the lowest at 30%. And even though doctors are reporting fewer severe cases, hospital officials say the increase in patients is placing an additional strain on an overworked hospital staff. More than 500 COVID-positive patients are currently in the Alabama hospital system, and doctors are basing the severity of those cases on ICU and ventilator use. Fewer than 100 of those patients are in the ICU, and fewer than 50 are on ventilators. But hospitals may have to ask staff to work extra shifts if caseloads continue to increase, which is why experts say it's important to be cautious to not only protect yourself, but also others.
Last summer and now, there was this mass exodus of people who left healthcare. Now, we filled some of that with traveling staff, but that's a temporary solution. Fewer staff in hospitals today than we might have in January of this year.
Experts add several factors are contributing to the decrease of COVID-19 case severity, including vaccines and other medications that are out there to treat COVID.
Well, typical summer-like weather is going to be the name of the game for this middle of July. Hit or miss rain chances and around average temperatures can be expected. I'll have all the details on that after the break.